What I'd like to talk about is autonomous and remote MRI. And the idea here is quite simple. We believe that rules that cardiac MRI today is done in a difficult way, and as many of the previous speakers already mentioned, takes too long, and the preparation is difficult. So what we need to do is to somehow, in a good MRI study, we need to be able to recognize what the problems are, and then we have to have the tools to be able to actually improve upon them and to correct the problems that we see. So the way that we see that the way to do this is with machine learning. And this obviously everybody else in the world is working a great deal on how to improve the recognition of diseases or image reconstruction. We decided that we're going to work on the front end of actually improving the acquisition itself. And so in the spirit of that, and let me see if I can play this. In the spirit of that, what we're doing here is first teach the machine how to recognize chest and abdominal anatomy. Once you're able to recognize chest and abdominal anatomy and recognize where they're located, you can then use that information to directly then control the machine. So on the right-hand side here is actually a slightly different model, what we're using to actually localize and scan the imaging planes that we need in as little as 5 seconds, as you can see. Everything that you see is actually happening in real time. It's controlled by the machine. No one's touching the machine. So as you can see, this can also be used for the purposes of actually detecting image abnormalities. In this particular case, on the left-hand side, are motion-related corruptions, and this is presented at a poster P305. You actually have a few minutes to come and spend with us. On the right-hand side, of course, we're doing the usual thing of detecting and segmenting the heart. And again, these are all done in real time. So now that we have the AI tools, if you will, of recognizing the anatomy or recognizing abnormalities of the heart so that we can fix the sequence, we now need some sequences to fix and to control. And this is actually a whole set of cardiac imaging sequences that we currently are FDA approved and CE marked for local real-time as well as batch imaging. We then take this, but of course, when you're able to do this, you're probably not going to hit it 95 or 100% of the time. Sometimes you're going to make mistakes. And so in this particular case, we also have a remote scanning capability so that as you're doing this study, as the machine is self-scanning, you're able to have an operator, experienced operator remotely that can monitor the situation and if need be, intervene on behalf of the actual scanner. Finally, when you put this all together, what I'm going to show you here is a video of a 15-minute exam. Now this slide is a little busy. I'm going to try to explain it as I go along. But first, as I said, we're going to go and find all the imaging planes that are necessary. And then we're going to do a perfusion stress study. And then we're going to obtain the LV function. And then we're going to do a 4D flow imaging study. And then finally, we're going to do a full set of delay enhancement evaluation. And we consider this, to borrow a parlance from the self-driving car literature, level 3 to level 4 autonomous machine driving. If you will, on the bottom right hand here, you can see that we are actually reconstructing the perfusion, the perfusion images, and simultaneously. Next, we'll show you the actually the acquisition of LV function with a compressed sense reconstruction that is done in real time, of course. And we're about 1 minute and 20 seconds on the right-hand ticker that you can see down below. And then now it's detecting the actual LV mass and function in real time. And we're about 1 minute and 50 seconds into this scan at this point. And remember, everything is being driven by the machine. There's no operator intervention at this point. All the slice selections, all the parameter setting, where the slices are located, where the perfusion slices are placed, all done automatically. Now we're acquiring 4D flow imaging data. And again, the machine is setting where it wants to take the data and setting all the parameters necessary to do this. We're going to accelerate this in just a moment. As you can see, we're displaying on the little bottom right corner the actual information that's actually being processed and shown. The reconstruction time for the 4D flow is about 2 minutes at this point. And finally, this is actually a couple of images used to acquire the inversion time. Again, the machine is doing this on its own. And then finally, we're actually acquiring the actual delay enhancement images. So now we're up to about 14 and a half minutes, or 10 and a half minutes. And we should be done with this particular study in a total of about 13 minutes or so. That's right. I hope I caught up a little bit. The next thing that's useful, is once you're able to acquire a set of data like this, there's still more to come. So what we've shown you is 15 minutes to do the entire ischemic cardiac examination plus 4D flow and reconstructing in that time frame, all done locally with the possibility of having remote supervision. But this is probably still not the optimal way of doing things. What we really like to do next is to have the ability to pick up the unusual things, what we call level 5, if you will, in car parlance, which is the unexpected thing that shows up in your scan that you weren't expecting to see, and therefore you would normally have to redesign your protocol in order to figure out what's going on. Here I'm going to use a brain analogy because we certainly think that this technology can be applied outside the heart. And what we have here on the right-hand side is a set of test data images, embedded in which are a couple of abnormal slices that the machine has never seen before and has never been trained for before. And in the very beginning of this video, I'm going to show you data that has a network that's not yet been trained. But as the slide plays, what we're going to do is actually gradually train the machine to recognize normals. And as it recognizes normals, and it's only trained on normals, it's going to actually get rid of all of the normals and leave you behind, in just a few moments, the 2 images that have strokes in it. Okay? This is very different from the standard classifiers that we use for machine learning in terms of saying, okay, I've got a stroke, I've got a tumor, I've got something else. Here we're not doing that. We're defining the normal set from a pure information theory standpoint. We're actually trying to come up with what constitutes normal. Being able to define that, being able to define the parameters for that, and then allow that to eliminate the things that we don't want to see. I think one of the previous speakers on one of the earlier sessions today had mentioned that possibility. How do you really find normals? And once you find the normals, how can you use that to filter them out so that you and I, as clinicians, can concentrate on the abnormalities? We expect to be able to use this to then redesign the next step, which is to say, what other sequences should we be using to really make this work on a clinical basis? So, in conclusion, blink of the eye. Last year, when we were at the SCMR, this is what we were showing. Not very impressive. This year, we're showing this. Next year, we're not sure. We are working with our partners from Circle, partners from GE, and also I want to add that we are able to now work with Siemens this year to try to introduce this technology onto all the favorite cardiac platforms and post-analysis packages. Thank you very much.